Hello and welcome to Capital Health segment with me, Modoni Wawero. Today we'll be talking about cervical cancer, it being the Cervical Cancer Awareness Week. Taking us through this discussion is Benda Kithaka, who is a health advocate rather. Karibu sana, Benda. Today we are talking about prevention of cervical cancer. Take us through that.
Okay, so Muthani, thank you for having me. And as you've mentioned, I'm a health advocate. I'm also a co founder of Women for Cancer Early Detection and Treatment. And rightfully so, we should be talking about cervical cancer prevention because for the work that we've done for the last 8 to 9 years now, we have been finding that our women are diagnosed so late in the hour when treatment costs are very high and the chances of recovery are really minimized. And yet, what people don't know, cervical cancer is preventable. It's the one cancer that gives us time to act. It's the one cancer that we know the causes and the one cancer that we can actually stop before it starts. So this being a Cervical Cancer Awareness Week, what we are targeting is to get people to understand what is cervical cancer, how can we prevent it, what do we need to do to take action towards stopping it before it starts. And where I would start is actually to commend the Ministry of Health that we now have a vaccine that is for cervical cancer elimination. The vaccine was introduced in October of last year. It's free of charge, available at all public health facilities countrywide, and also available in faith-based hospitals as well as private sector. And it's available to all girls who are aged 10 years and in 2 doses. Why I say this is because we know the vaccine is safe and we know it is effective in prevention of cervical cancer. So someone will ask, why then are we targeting girls? And the thing is, cervical cancer takes between 5 to 20 years to develop in the body. At that time, somebody doesn't know what's going on in the body. And as we know, our health-seeking behavior is such that people go to hospital when they are sick. We want to let people know that cervical cancer is preventable. There are no signs and symptoms when it starts, and therefore the time to screen is now. We need to take action before it happens. And why then we're going to preventing with the vaccine is because we're giving the girls immunity. We're helping their immunity develop to be able to prevent cervical cancer in the future. And the time to do it is when they're in their adolescent age, when the virus HPV has not been introduced in the body, and therefore they can be able to better fight it in the future. The vaccine is only primary prevention. There is secondary prevention. And secondary prevention is getting women screened when they don't have signs and symptoms, when they wouldn't even think that they're sick. And that is why the National Cervical Cancer Awareness Week, because we want to sensitize women that this is the time to get screened. If a woman gets screened today and she's found to not have any cervical cancer, precancers, or any signs and symptoms, and therefore she's okay, she can wait for 5 years. That's what the guideline says. She can wait for 5 years without coming to get screened again. 5 good years. Women don't do this. They're afraid, oh, what if I go and get something? And we want to assure them, if you go get to find something suspicious, we're not leaving you. We are working with you together with the ministry and all the other partners to ensure that you get into the referral system. And therefore, that becomes secondary prevention, where if we should find something developing in the body, it's 100% treatable if discovered early.
Since the launch of the HPV vaccine last year, I know the target mark was put at 800,000 girls from the time it was launched to now this year, October. We'll have a checkup of how we are faring. But so far, do you know how we are faring in terms of the vaccination program?
One of the successes that we've had is that because of the communications that we put out there, working together with the ministry, working with other partners, people are now asking where they can go and get this vaccine. There before it was, I will not go. Now they are asking where to go. The second success is we find that the Christmas period, there was no much activity because that's the festivities. When we've come back, facilities are now getting more people bringing their daughters to be vaccinated. And conversations that we are having with parents and having with caregivers is that they want to protect their children against this cancer. The reason being, it's unfortunate. We plant a seed today to eat the fruits in the future. The seed we're planting today is prevention way before the girl has even been introduced to HPV. If we don't do it today, it's targeted that it's actually projected would be having 13,000 women dying by 2030 out of a disease that's preventable. For us to get there to 13,000 in 2030, it's because somebody will not have done their job. And that's in the planting of the seed today. So my ask of Kenyans is, let's look at what we want to do for our children for the future. We want them to have a good education. We want them to have a good life. We want them to be in stable relationships. We want them to have children so that we can be grandmothers and grandfathers. But for that to happen, we need to prevent cervical cancer today by giving them the vaccine so that in the future they can focus on the things that really matter in their life. Cervical cancer should not be one of them.
A word of advice to women, especially this week, it being an awareness week, encouraging them to go and have the free screening in our facilities.
Okay? I'm known to twist questions. So, an advice to men before I get to the women. Cervical cancer affects women, our sisters, our mothers, our cousins, our co workers, our friends. Okay? And every man on this earth has someone dear to them who is a woman. It's imperative that men also encourage women to go get screened. We cannot have men sitting by the sidelines and saying that's a women's issue. When a woman dies in a family because of cervical cancer, the children are affected, the community is affected, the man of the house is affected. And therefore, it's everybody's responsibility. Now, to the women, it takes maximum of 15 minutes in the doctor's office. 15. 15 minutes is the time that it takes a woman who loves coffee to sit in a coffee bar and have their coffee. For a woman who is in the village, that 15 minutes is what would take to switch on the radio and listen to the news of the day. 15 minutes is something that they ought to prioritize. By the way, only 5 minutes on the doctor's couch, 5 minutes to get ready, and 5 minutes to get back on your clothes. It's imperative that our women take charge of their health. We cannot give cervical cancer the time that it gives us. Let's take charge of our health, and by taking charge is to go get screened so that we find out what's going on before, way before the symptoms and signs start coming, because then it's not even cancer, it's called pre-cancer. And it's treatable 100%. We have survivors to prove that. And for those who are hesitating and saying, oh, it's painful, it's uncomfortable, it's so many things. We do a lot of things that are uncomfortable, that we don't see as life-threatening. Because, hey, what's wearing heels and walking 15 minutes in heels? It's very uncomfortable. Imagine going to the doctor's office and getting that screening, knowing that you're taking charge of your health and preventing something that could be fatal if not discovered early. Shouldn't we be doing it? So my ask of communities is, it's not a woman's job alone to prevent cervical cancer. It's everybody's business. Parents, caregivers, take your children for the vaccine. Men and the caregivers around the community encourage women to go get screened and encourage parents of 10-year-old girls to go get the vaccine. Policymakers, provide the resources necessary for the vaccination as well as for the screening. And the community at large, let's stop not talking about it. Let's start talking about cervical cancer as if it is a life and death issue, because indeed it is. If we don't act now, our women in the future will be affected. It's everybody's business.